The Solidarity Airway Stabilization System is an interlocking tube securement system with active stabilization components on both the endotracheal tube and stabilizer, designed to better secure the endotracheal tube against increased forces without pinching, crimping, or squeezing the tube. Here's how it works. The first step, pre-intubation preparation, is to check the function of the stabilizer and endotracheal tube and prepare both devices for intubation. Remove the stabilizer from its package by pulling on the perforation across the top of the polybag. Check the integrity of the door latch. Push the door release button and then pull on the door handle to open the door. It should snap into the full open position. Close the door and push on the door handle until the door latches snap into place and lock. Pull on the door handle to confirm the door latches securely. Now prepare the stabilizer so it is ready for application after the patient is intubated. Remove the rubber band and unfold the strap. Press the door release button and pull the tower door to a full open position. Next, select a Solidarity tube by choosing the appropriate type and size based on the patient's age, physical characteristics, and suspected length of intubation. After making your selection, check the package for damage. If the package has been previously opened, do not use. Remove the tube and mounting card from its package. Then remove the tube from its mounting card. Test the integrity of the cuff inflation system. Fill a 20 milliliter syringe with air and attach the syringe to the inflation valve. Inject air until cuff is fully inflated. Palpate the pilot pillow to ensure the cuff inflates properly and doesn't show evidence of a leak. Completely evacuate air from cuff. A standard 15 mm connector is secured to the Solidarity tube with a twist lock mechanism. It can be removed and replaced as desired. To remove the 15 mm connector, rotate counterclockwise until the connector flanges are no longer under the locking canopies. Then, pull the connector straight out. Note, if the 15 mm connector will not easily rotate, rock the 15 mm connector to the side with your thumb to break the seal and proceed to rotate and remove the connector as noted. To replace, insert the 15 mm connector into the end of the tube and rotate clockwise until the flanges are seated under the canopies. Step 2 is to orally intubate the patient. Due to ribs on the tube, the Solidarity tube is not intended for nasal use. Orally intubate the patient. Place the Solidarity tube at the proper target depth, which centers the vocal cords between two reflective depth localizer bands. To achieve this, visualize the cuff and the first localizer band as they pass the patient's vocal cords. Stop insertion prior to the second localizer band reaching the vocal cords. Once the tube has been placed at the proper depth, note the position of the numeric depth markers relative to the patient's upper incisors, and maintain the tube at that depth by firmly gripping the tube until the application of the stabilizer has been completed. Insert the syringe into the inflation valve and inflate the cuff with enough air to provide an effective seal of the cuff against the tracheal wall. Remove the syringe. Begin bag valve mask ventilation and ensure adequate air movement into the patient's lungs. Confirm proper placement and depth of the endotracheal tube within the trachea. Check waveform capnography, pulse oximetry, and listen to bilateral breath sounds. Step 3 is to secure the Solidarity tube with a Solidarity stabilizer. Do not allow the tube to move while applying the stabilizer. Position the stabilizer with the open tower door and open portion of the stabilizer base facing the patient's nose. Place the stabilizer firmly against the mandible and cheeks. While maintaining the position of the ETT, engage the Solidarity CAD collar ribs within the recesses of the stabilizer. Close the stabilizer door until the door latches completely and you hear an audible click as the release button snaps into the locked position. Pull on the door handle to ensure that the door is locked in the closed position. While maintaining the stabilizer firmly against the mandible and cheek, secure the strap by passing the loose end under the patient's neck and then up through the stabilizer's strap slot. Pull the strap upward and outward until the stabilizer is firmly against the face, and then pull the strap downward and engage the hook and loop closure. Adjust the strap on both sides until firmly secured. However, To minimize risk of skin injury, do not over-tighten. After application of the stabilizer is completed, recheck the position of the tube's numerical depth markers relative to the upper incisors. They should be in the same position as noted immediately after intubation. Obtain X-ray confirmation of appropriate depth positioning. Step 4 is routine care of the intubated, mechanically ventilated patient. Routine care includes ensuring the tube is maintained in its optimal position in the trachea, repositioning the tube when necessary, and daily oral care. Once the tube is placed, X-ray confirmation of the tube position may indicate the need for repositioning. For example, let's say that the radiologist report indicates the solidarity tube needs to be repositioned 2 centimeters deeper. Note the starting position of the CAD collar position indicator. In this example, the position indicator is at position number 2. Determine the distance and direction the tube needs to be moved. In this example, the tube needs to be repositioned 2 centimeters deeper. Determine the new position to which the CAD collar must be moved. In this example, the position indicator needs to be moved from the starting position number 2 to its final position number 4, 2 centimeters deeper. Note that the positioning scale is in half-centimeter increments. To reposition the tube, deflate the balloon. Push the orange door release button and swing the door to the full open position. Disengage the CAD collar from the stabilizer. Move the tube so the CAD collar position indicator is adjacent to the desired repositioning guide mark. Re-engage the CAD collar. Close the stabilizer door until it latches completely and the release button snaps into its locked position. Then pull on the door handle to ensure it is securely locked. Re-inflate the balloon. To minimize the risk of pressure injuries to the skin and oral tissue, the tube should be regularly repositioned laterally. To reposition laterally, move the entire stabilizer tube unit as one laterally to the desired position, while maintaining contact of the stabilizer foam with the face. Once in its desired position, refasten the strap. When the patient's level of consciousness increases to the point that it presents an increased risk for the patient biting down and kinking the tube, insert a bite block. Oral care is an important aspect of routine daily care of the intubated patient. To perform oral suctioning, laterally reposition the stabilizer so that the oral access window is over the oral cavity. Insert the suction catheter through one of the oral access windows into the patient's posterior pharynx. Suction oral secretions. To perform oral care, insert the toothbrush or swab through one of the oral access windows. The stabilizer can be repositioned laterally as needed to improve access to any particular area of the oral cavity. If using the Solidarity subglottic suction tube, regular suction of the subglottic space should be performed. This should be done via intermittent suction techniques. To perform subglottic suction via a syringe, remove the suction cap and attach a syringe to the connector. Pull on the syringe barrel to remove secretions. When suctioning is complete, remove the syringe and recap the connector. To perform subglottic suction via a suction device, remove the cap and attach the suction hose from the canister to the suction connector on the tube. Set the vacuum pressure, less than 20 centimeters water. Turn on the suction to remove secretions. When suctioning is complete, turn off suction, disconnect tubing, and recap the suction connector. Step 5 is extubating the patient. After determining that the patient is ready for extubation, ensure that resuscitation equipment is readily available at the bedside. Sit the patient upright when appropriate and suction the oral cavity. Remove the bite block if present. Deflate the cuff by inserting a syringe into the valve and remove air until the cuff completely deflates, which can be noted by a definite vacuum in the syringe. Unfasten the strap and remove the tube and stabilizer as a single engaged unit. If the patient bites down on the tube, do not attempt to forcefully remove it. Properly discard the tracheal tube. Working to eliminate unplanned extubation, improve ventilated patient safety, and deliver peace of mind. This video is intended for instructional use only. Before using this product, review the instructions for use found on the product packaging or visit www.securisyn.com/instructions.